The Troponin T test carries a unique authority because it speaks directly from the level of injured heart cells, offering evidence that goes beyond what the eyes can see or what the patient can describe. Chest pain, shortness of breath, and fatigue are deeply subjective experiences. They are filtered through fear, memory, pain tolerance, and expectation. Even the electrocardiogram, a powerful tool in its own right, reflects electrical patterns rather than physical damage. It can suggest stress or ischemia, but it cannot always confirm that heart muscle cells have been harmed. Troponin T fills this gap by translating invisible cellular injury into measurable biological data. When heart muscle cells are deprived of oxygen or exposed to extreme strain, their internal structure begins to break down. This is not an abstract process. It is a physical disruption of membranes and proteins that once functioned with precision. Troponin T escapes into the bloodstream as a result of this damage, not as a signal the body intentionally sends, but as a trace left behind by injured tissue. Detecting this protein in blood is therefore equivalent to finding fingerprints at the scene of an event. It tells us that something real and tangible has occurred within the heart, even if other signs remain ambiguous. This directness is what makes Troponin T so valuable in uncertain clinical moments. Many patients arrive with symptoms that overlap with anxiety, indigestion, muscle strain, or respiratory conditions. In such situations, relying only on symptoms can lead to delay or misinterpretation. Troponin T does not depend on how clearly a patient can describe pain or how dramatic the presentation appears. It offers a biological confirmation that bypasses uncertainty and emotional noise. When levels are elevated, the question is no longer whether the heart has been affected, but how and why. The test also reshapes the timeline of diagnosis. In earlier eras, clinicians often had to wait for unmistakable signs of heart damage, sometimes losing precious time. Troponin T allows detection at a much earlier stage, when injury may still be evolving. This early insight changes decisions in real time, influencing monitoring intensity, medication choices, and the urgency of intervention. It shifts care from reaction to anticipation, from guessing to informed action. Perhaps most importantly, Troponin T reflects a deeper philosophical shift in medicine. It represents a move toward listening to the body at its most fundamental level. Instead of relying solely on surface signals, medicine now pays attention to molecular evidence, to the quiet release of proteins that reveal suffering long before it becomes irreversible. In this sense, Troponin T is not just a test, but a reminder that truth in biology often resides in small, measurable details. By honoring these details, clinicians honor the patient, responding not just to symptoms, but to the real, physical experience of the heart itself. An elevated Troponin T level carries great significance, but it also demands restraint and wisdom in interpretation. It is tempting to view a raised value as a definitive label, to immediately equate it with the heart attack and allow that assumption to guide every decision. Yet the human body is more complex than any single pathway, and the heart responds to many forms of stress beyond blocked arteries. Troponin T does not announce the cause of injury, it simply confirms that injury has occurred. This distinction is subtle, but it is essential for thoughtful and responsible care. Heart muscle cells are sensitive to their environment. They depend on a constant supply of oxygen, balanced electrolytes, and coordinated electrical signals. When any of these conditions are disrupted, even temporarily, cells may suffer enough damage to release troponin. Severe infections can overwhelm the body and increase the heart's workload beyond its limits. Kidney disease can reduce clearance of troponin from the blood, leading to persistent elevation. Prolonged low blood pressure, uncontrolled fast heart rhythms, and extreme physical or emotional stress can all strain the heart in ways that leave measurable molecular traces. In these situations, troponin elevation reflects vulnerability rather than a classic heart attack. This is where clinical thinking becomes an art as much as a science. The number alone is not the answer. It must be placed within context, woven into the patient's story. The timing of symptoms, the pattern of rise and fall in troponin levels, the electrocardiogram, imaging findings, and the individual's medical background all contribute to meaning. A sudden sharp rise followed by a gradual fall suggests an acute event, while a stable, chronically elevated level may point to ongoing strain or systemic illness. Without this broader view, there is a risk of overtreatment or misdirection, both of which can cause harm. The need for interpretation also reflects respect for uncertainty. Medicine is often pressured to provide quick, definitive answers, but biology rarely cooperates with simplicity. Troponin T reminds clinicians to pause, to ask not only what the test shows, but why it shows it. This pause creates space for better decisions and more personalized care. It prevents the reduction of a human being to a lab value and reinforces the idea that tests are tools, not verdicts. In a deeper sense, this complexity mirrors life itself. The heart responds to physical illness, emotional strain, and systemic imbalance as a single integrated organ. An elevated troponin level can be a warning sign, not just of blocked arteries, but of a body under profound stress. Recognizing this broad meaning allows care to extend beyond emergency intervention toward addressing underlying conditions, resilience, and recovery. Troponin T, when interpreted thoughtfully, becomes a guide rather than a command, encouraging medicine to listen carefully, think deeply, and respond with both precision and compassion. The true strength of the Troponin T test lies in its ability to reveal danger early, often before the heart has crossed the point of irreversible damage. The heart is resilient, but it is not invincible. When blood flow is compromised or stress overwhelms cardiac muscle, injury begins quietly at the cellular level, long before it becomes obvious on scans or through severe symptoms. Troponin T gives medicine access to this early phase, allowing clinicians to recognize harm while there is still time to protect what remains healthy. This early visibility transforms urgency from panic into purpose. In emergency settings, time is the most precious resource. Minutes can determine whether heart muscle recovers or dies, whether a patient returns to a full life or carries permanent limitation. Troponin T helps narrow uncertainty quickly. When levels are elevated, clinicians gain confidence that the heart requires immediate attention, even if the clinical picture is incomplete. This clarity accelerates decision-making, guiding rapid monitoring, appropriate medications, and timely referral for advanced care. Instead of waiting for damage to declare itself dramatically, medicine can act while the injury is still unfolding. Early detection also reshapes how care is delivered beyond the emergency moment. Serial troponin measurements reveal trends, not just single values. A rising pattern suggests ongoing injury and the need for escalation, while stable or falling levels may indicate that interventions are working. This dynamic feedback loop allows treatment to be adjusted in real time, aligning medical response with the heart's actual condition rather than assumptions. It reduces both undertreatment and unnecessary aggression, creating a balance between caution and action. There is also a protective aspect to early detection that extends into prevention. An elevated troponin T can uncover silent or atypical heart injury in people who might otherwise be overlooked, including older adults, individuals with diabetes, or those who experience minimal pain. By identifying risk early, clinicians can address contributing factors such as uncontrolled blood pressure, anemia, infection, or lifestyle strain. In this way, the test not only responds to crisis, but opens a door to longer-term cardiovascular protection. At a human level, early detection preserves trust and dignity. It reassures patients that their suffering is being taken seriously, even when outward signs are subtle. It replaces waiting with understanding, fear with informed care. Troponin T becomes a quiet ally in the fight against sudden loss, translating microscopic signals into meaningful action. Through this early insight, medicine honors the fragile window in which intervention still matters, offering the heart its best chance to heal and continue its work of sustaining life through each fragile, irreplaceable beat. The Troponin T test stands at a rare intersection where scientific precision meets human compassion. At first glance, it appears as a simple laboratory value, a number printed on a report. Yet behind that number lies a deeply personal reality, one that connects molecular injury to human vulnerability. Each elevated result represents heart cells that have struggled and a person who may be frightened, uncertain, or in pain. The test allows clinicians to move beyond assumption and respond with clarity, transforming fear into informed action rather than hesitation or dismissal. Compassion in medicine is not only expressed through words or gestures, but through accuracy and attentiveness. Troponin T supports this form of compassion by reducing doubt when decisions matter most. When clinicians can rely on objective evidence of heart injury, they are better equipped to advocate for urgent care, to explain risks honestly, and to involve patients and families in meaningful discussions. This clarity builds trust. Patients sense when their condition is understood rather than guessed, and that understanding itself becomes a form of comfort. At the same time, the test demands ethical responsibility. Because troponin T is so sensitive, it can detect injury in fragile hearts under stress, not just dramatic emergencies. Responding compassionately means avoiding alarm where it is not warranted and avoiding neglect where action is needed. This balance requires clinicians to see the patient as more than a case, to consider age, chronic illness, emotional strain, and social context. In doing so, the test becomes a guide that supports thoughtful care rather than mechanical decision-making. There is also a quiet dignity in how troponin T allows suffering to be acknowledged. Some patients struggle to articulate their symptoms or fear they will not be believed. Others present atypically, their pain muted by age or disease. When troponin is elevated, their experience gains legitimacy. The body speaks on their behalf, and medicine listens. This recognition can be profoundly validating, reinforcing the idea that every complaint deserves attention and every heart deserves protection. On a broader level, troponin T reflects the evolution of healthcare toward deeper respect for biological truth. It shows how understanding the smallest components of life can lead to more humane outcomes. By translating microscopic injury into actionable knowledge, the test bridges the gap between laboratory science and bedside care. It reminds us that progress in medicine is not only about advanced technology, but about using that technology to preserve life, reduce suffering, and respond to vulnerability with precision and empathy. In this way, troponin T becomes more than a diagnostic tool. It becomes a symbol of medicine's commitment to see, understand, and care for the human heart in all its fragile complexity.